Medicare, Medicaid accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and we hope you're all well, enjoying the show and the weekend, and let's talk about some new cases. One woman we treated, 97 years old. She flew in from California 3 years ago. She had a big swollen arm. She went to the major hospitals in L.A. No one could help her. They said, you're 93, 94 years old. You've lived your life. But she was miserable. Her hand was swollen. She has a loving daughter. Well, no one could figure out in L.A. what the cause was, believe it or not. But we worked her up here. We found a nodule of cancer that was blocking the vein. We treated that nodule. Her hand opened up. The blood vessels opened up. And for 3 years, she's been doing great. Now, she has stage 4 cancer, so we know with stage 4, it's possible for the cancer to come back. Well, her cancer came back, not in that location. And again, our success rate for metastatic breast cancer is about 90+%. So it's very unusual for cancer to come back. But it came back in a nearby spot, and another radiation doctor saw her because of a broken bone, and he wanted to give her standard radiation. Well, first of all, in that area, she'd already had radiation for her breast cancer years before I met her. Then we gave radiosurgery. And now he wants to just give her a couple treatments of standard radiation to a large area, which probably wouldn't help her and probably would hurt her. So her daughter asked me what I would advise. I advised against that because the likelihood of helping is small. The likelihood of hurting is significant. Why do something that's not likely going to help? She had fluid in the lung. The fluid was removed. She was very anemic. She was transfused. She's feeling better, and I hope at 97 she has the strength to consider coming out to New York for radiosurgery to treat that new nodule of cancer, which is what I would do if it were me, if I could bring Mom here. And another patient, very young at the other end of the spectrum, 33-year-old woman, has 6 children and has colon cancer. She had multiple pregnancies. She had 7 pregnancies in her last 10, 12 years. And during those pregnancies, she was gaining weight and losing weight, and she had constipation and abdominal symptoms. Well, lo and behold, she was found to have a colon cancer that had already spread to the liver at her young age. Now, she had some blood in the rectum for several years. Unfortunately, it was never worked up. Finally, she had colonoscopy, and they found the cancer, and she had stents placed and chemotherapy with a partial response. Then she went to a big cancer hospital, and they did big surgery on her. And since that time, she's been on chemo, and came to us. And again, I think it's the obligation of a doctor to tell the patient the truth, and we told her and showed her exactly where the cancer was. They were talking about doing radiofrequency ablation for cancer in the lung. Well, that's a way of putting a needle into the chest, so it's an invasive procedure. It requires anesthesia, and you put a needle into the lung, it can collapse the lung, compared to radiosurgery, which has about a 90% success rate rather than 60. Radiosurgery is non-invasive. There's no cutting, no bleeding, no anesthesia, no hospital stay. You just come in. Each treatment's about 15 minutes. Usually there's 5 treatments. and her success rate is about 90%. So she was told about all the options. She has stage 4 colon cancer, metastatic to the lung. It was also metastatic to the liver. There are options available, and we told her about all the options. We asked her for a new staging, and hopefully she's going to consider getting staged and treatment with what she believes is the best option for her. And another woman came in, 71 years old, with endometrial cancer, which is a cancer of the lining of the uterus. She had vaginal bleeding in 2011. She had a D&C. She had radiation to the pelvis, standard radiation, and then surgery. And by 2013, she had recurrence in the pelvic area and the vagina area, and had chemotherapy for more than a year and a half with continued pain, continued bleeding. She had a biopsy of the labia showing the cancer had spread there. She came to us. She actually had lost 3 units of blood a month ago and 2 units of blood a week ago. And all they were doing was transfusing her, not treating the cancer. The chemo was ineffective. Chemo does not work very well for endometrial cancer. She came to us. We staged her up. We saw the extent of cancer, and we got her treated in the vagina. And last news we got, no more bleeding. So we hope the bleeding stops, and we would, of course, offer her radiosurgery for the other spot. She has a mass in the adrenal and another mass of cancer. So there is other options besides continued chemo. Sometimes you wonder why there's so much chemo in the world, and then you read about the budgets of these pharmaceutical companies, which are billions and billions of dollars, and they give cancer hospitals and other hospitals tens of millions of dollars, and sometimes even the doctors sit on the pharmaceutical boards, and the pharmaceutical companies give the hospitals money. So with us, a private cancer center means we don't take money from drug companies. The opinion you get is a pure opinion on what we think is the best options for you, and it may be radiosurgery, it may not be radiosurgery, but you'll hear an unadulterated view of the options that's not influenced by drug money or other money or clinical protocols. No, we're trying to provide the best cancer treatment options to each patient. That's the beauty of Radiosurgery New York. So, I want to talk just for a minute about a woman with fallopian tube cancer. She's about 70. She had 18 different kinds of chemo for metastatic fallopian tube cancer. The fallopian tubes are the little tubes from the ovary to the uterus where the little egg goes every month, leaves the ovary, goes down the fallopian tube, and lodges in the uterus, and if it's lucky she gets pregnant and the little egg turns into a little baby in 9 months. Well, this woman at age 70 has her fallopian tubes. The cancer grew there, and it spread to the lymph nodes in her pelvis and her abdomen. She had 18 different kinds of chemotherapy over years. She lost her hair, she had neuropathy, and worst of all, it didn't work. So she came to us, 5 treatments. Her cancer marker went down from 5,000 down to 50 in just 5 treatments. So congratulations to her. We wish her well, and most likely it will keep on shrinking over the rest of her life thanks to radiosurgery at our facility. We have a caller. Hello? Mike?
Yes, hello?
Good evening.
Yeah.
How are you?
Good, how are you, Doctor?
Fine. What's your question tonight?
Well, I'm pretty sure I have prostate cancer. I had a PSA about 3.5 years ago.
Mm-hmm.
It was 59.
Wow, pretty high.
Yeah. And so I tried to surmise what I did wrong, and I was at the time 58, I believe.
You didn't have to do anything wrong to get prostate cancer. Don't feel guilty about it. Men get prostate cancer. It's nothing you did or thought. It's not from smoking or drinking. So don't feel like it's something you did wrong.
Yeah, well, I just wanted to go over my life. I'm probably a scientific person. I try to think there's a reason for everything. And,
well, sometimes there's not.
I did abuse antibiotics.
Well, sometimes there's not reasons, and antibiotics don't cause prostate cancer. Anyway, did you get a biopsy?
No, I didn't. I've never had a biopsy, and it went from 81 pretty quickly, and then in the next 3 years, it only went to like a 103.
So why don't you come in? Why don't you come in and get a biopsy?
The only time my PSA went down is just to illustrate a point. I was on itraconazole.
Ketoconazole. But ketoconazole is a treatment for prostate cancer, so it's not to illustrate a point. Ketoconazole is well known, but the problem with ketoconazole is it doesn't cure anybody. It's only temporary relief. And there are treatments out there that have a chance of curing. We're down to 30 seconds, so I'm sorry we don't have much time to talk about this case, but I'd refer you to our booklet, and you can look at our high-risk cancer patients. It's on page 11 of our booklet. For high PSAs, we have a 70% cancer-free success rate. So give us a call during the week at 212-CHOICES. Call me directly at 212-CHOICES. That's 212-246-4237. I would love to meet with you and anyone else who has a question about cancer treatment. Thank you for listening. It's a pleasure and an honor. Thank you, and God bless you, and good night. Bye.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day, because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
The proceeding was a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed, 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 or the ideas